Assalamualaikum. Hi everyone. My name is Nur Aiza Izzati binti Azizi. I'm from class DLH1B. My metric number 23 DLH21 F2043. Assalamualaikum. My English presentation, I'll be talking about depression. So the objective of my presentation today is about the different types of depression, the cause and symptoms, and the common sign in the depression. So let's get started. So basically, everyone has ups and downs in their life. There are times when people feel sad or develop a feelings of despair and emptiness. However, when these disappointments, this despair, and this sadness takes a hold of life, the situation is commonly referred as a depression. There are three different types of depression. The first one is low-grade depression. Low-grade depression is where they feel moderately depressed on certain days and have a normal mood on the other day. Number two is a seasonal depression. Seasonal depression is known as a seasonal affective disorder. It is usually triggered by very limited daylight exposure during the winter. And number three is a major depression. Major depression is where they are unable to experience any kind of pleasure and generally are unable to enjoy life. If this type of depression is not being treated, it can last for a very long time. So for the cause and symptoms is, at the initial stage, most of people are not aware about their illness because they think that many symptoms are just the features of their personality. Experiencing inner discomfort, which can be difficult to express in words, they do not seek for a professional help. As a rule, usually they will go to the doctor at a time when the disease is already strong, holding the patient, causing unbearable suffering. One thing that makes depression difficult to determine is that the sign of depression vary with each individual. However, there are some common symptoms that can be used to determine if a person is suffering from depression or not. So here is a list of some of the common signs of a depression. Number one is people suffering from depression experience big changes in their sleep patterns. They suffer from oversleeping where they feel like sleeping all day long. On the other hand, some of the sufferers develop insomnia where they are unable to sleep and feel drowsy all day long due to lack of sleep. Number two, depression sufferers suffer from weight gain or weight loss at a very fast rate. Some of the sufferers gain weight at a high rate, 5% of existing body weight in a month. Whereas, some of the sufferers start losing weight as they lost their appetite. Number three is depression sufferers also have a very bleak outlook towards life. They generally feel that nothing is going to get better and they cannot do anything to improve their situation. They have this feeling of hopelessness and they feel no control over their own life. Lastly, number four is people with depression often thinks in their minds is that they always want to commit suicide and that. So for my conclusion of my presentation today, depression is a very complicated and it is impossible to cure it only with the help of medication or pills. It is believed that psychological and social factors combine to cause a depression. Relationship, coping skills, and healthy lifestyle choice plays an important role in depression. The chances of recovering from depression are there if one seeks help at the right time. It is important for a person to seek professional help as early as possible to ensure that the person is able to enjoy his or her life as usual. So that's all for my presentation today. Thank you guys for watching. We will meet again next time. Bye.